I'm Kelly Firesheets, and I'm with Cordata. We have a comprehensive platform that supports first responders like police, fire, peer recovery supporters as they implement pre-arrest diversion and deflection programs. I was originally trained as a clinical psychologist and came into the nonprofit and social sector industry as an evaluator and a researcher. So I've measured programs and looked for program outcomes. Probably about 7 to 10 years ago, we started to notice this trend of the opioid epidemic in the greater Cincinnati area. And so I started to focus specifically on programs that addressed opioid addiction. While doing that work, I met a group of folks in law enforcement who were collaborating with treatment providers and people in recovery to try to help move people into treatment and appropriate services instead of arresting them. In that work, one of the biggest challenges was that we couldn't find data. My favorite memory was a cop who had a desk with a bunch of Post-it notes on it. And he would color code the Post-it notes, and that's kind of how he was keeping track of people. So we started looking for a system to help us support those teams and support the work, but also to provide the bigger picture data so we could understand what was happening on the ground. And that's when we found Cordata. So the system that we're using today was designed by and for pre-arrest diversion programs. Cordata would convene meetings of folks who were on the ground doing this work every day and walk through screenshots and processes with them. And using their feedback, they built a system that is simple enough to meet their needs, but also has the ability to expand as the teams take on more or add partners. One of the other wonderful things is that in this space, we see lots of innovation and new ideas and new programs. And by collecting the data, we can share information across the programs and they can learn from each other. So it shortens our innovation curve and it shortens our learning curve. And hopefully that means we get better and we save more lives faster. So the programs can make even day-to-day decisions more strategically by using the data. And we have a feature that allows them to plan out their workflows so that when they go out in the community to meet with people, they can plan their visits so that they're not driving all over the place. Just very simple things like that. It also helps them to look just at overall data and trends to see how long people are engaged with the team or how often on average they're able to contact people. Those types of information help them plan for staffing and workload and to understand what they need to be effective and what the right amount of support is to get people the help that they need. The Cordata platform is HIPAA compliant, which allows us to store these data as if they are health data, and we keep them just as secure as people's electronic medical records. So Chief Synan and I met about 5 years ago as we were starting the Hamilton County Heroin Coalition. And we came into it with really different perspectives. I was a researcher and an evaluator, and he was a police chief. But the one thing that we actually agreed upon was that we really wanted to see numbers. And we would go into meetings and we would ask people for data. And we would ask to see data and we would ask people to share data. It was not popular, to be honest with you. It was not a popular request in the beginning. But we, kind of over time have pushed and worked to build collaborative relationships so that people can share data. And I'm really proud to say that in Hamilton County with the coalition, we now have a really robust data profile, both to understand when overdoses are happening and where they're happening, but also to understand what's happening on the ground to respond to those overdoses and how effective we are at getting people connected to treatment.
Hi, I'm Tom Synan. I am the police chief for the village of Newtown, and I am also a co-chair for the Hamilton County Addiction Response Coalition. I've been the police chief here in Newtown for going on 28 years. I got involved in the addiction crisis after I seen an entire family here in Newtown die from addiction. The mother and all 3 of her sons. Looking out my window, I can see the grandmother that's raising 5 of the grandkids 3 of the 5 are struggling with addiction themselves. So that kind of led me to helping to put this a little bit more out in the public, addiction itself, and can we do things differently? And so back in 2014-15, began the Hamilton County, what we call the Heroin Coalition, but is now the Hamilton County Addiction Response Coalition. And the thought being, could we bring community members that were part of the addiction solution and also the addiction problem, bring them together around a table, and could we work on more longer term resolutions to deal with addiction, not only save lives, but get people connected to treatment and longer term care. The other part of this that's really key is data. You have to have data, but I'm gonna reframe data. We have a ton of data. We have data from every different angle. I get 6 different reports, and I think a lot of times when people go into joining or building relationships, connecting networks, connecting resources, the first thing they always say is, I need data. Well, it's not a matter of do you need data, do you have actionable data? Can you use what I need, and vice versa? Do I have data that you can then use to enhance your program? If another police chief came in and asked me why would I be interested in Cordata, I would tell them that it allows you to connect you to other services. We in law enforcement aren't the answer to resolve addiction. It is a chronic mental medical health condition. So we don't have the tools and knowledge and resource to do it. So if you have a system like Cordata, what it does, it brings all the resources into one system. So now you're able to communicate with other systems, and what you're really doing is you're building a coalition off of actionable data. So even if you're all not sitting at the table talking to each other, because you're sharing that information, because you're sharing that data, because you have access to certain information, and it can be filtered in different ways, they know that you're connected to the system. And from a police chief side, from a law enforcement side, now I can now communicate with my quick response teams, my law enforcement diversion, my court programs, with hospital systems. What you did is you built a system. So you as law enforcement, if someone's not going into the jail system, if someone is just overdosed and you brought them back, you know they can get into this continuum care model system, this collaboration, and you can then follow all the way through the progress. And if someone falls out of the system, you know where they fell out, you can put them right back in. So Cordata gives us the opportunity to mesh systems that it's already working in, the criminal justice system and the healthcare system. And if we can bring both of those together with Cordata, what it does is it transitions addiction out of the criminal justice system. So instead of punishing those addicted, we can actually legitimize addiction as a chronic mental medical health condition and treat it as such.
So at Cordata, we've learned that it's not just technology or software that makes change. You really have to have good, strong, collaborative programs. So we provide software, yes, but we also provide a lot of support to help programs and people become successful. And that might be consulting services, that might be help setting up a team, that might be connections to other resources like national experts, things like grant writing, evaluation support, all the things you need to make your project successful, because if the program itself isn't successful, none of us are. So the best way to start is really to see the software. So we can schedule an appointment to show you the software and then have a conversation about how to make it work for you and fit in your program.